Welcome back. So in Inshort series, now we'll be seeing infective endocarditis or it's also known as bacterial endocarditis. So here it is a serious infection of the valvular and mural endocardium. Valvular and mural endocardium is affected, and it can be caused, as the name suggests, by bacteria, and it can result in typical and friable vegetation, and some of the organisms that can affect can be tubercle, bacilli, or even fungi. And looking at the two types, there are acute as well as subacute. Now just briefly going through the differences. Acute is less than 6 weeks and subacute is greater than 6 weeks. And the organism most common is Staph aureus in case of acute, and in case of subacute it is Streptococcus virulence. Moving on, looking at the virulence of organisms, it is highly virulent, whereas subacute is less virulent. Now moving ahead with the whether it can be whether it affects the previously affected one. So it's normal. Previously it is normal, whereas in subacute it's usually damaged. It affects the damaged ones. Moving next, looking at lesions, it causes invasive and destructive or suppurative, whereas in case of subacute it usually is not invasive. It's not invasive or suppurative. And moving on quickly to the clinical features, it has features of acute systemic infection, and the other feature here in subacute, it is splenomegaly as well as clubbing and petechiae, clubbing of the fingers and petechiae. Now moving ahead with some of the predisposing factors. So under this, it can be due to transient bacteremia as well as septicemia or pyemia, and it can also result in underlying heart disease and impaired host defense. Now looking at the first point, that is transient bacteremia and septicemia. Under this, it can lead to maybe due to some periodontal infections, or maybe due to some genitourinary tract infections, gastrointestinal tract infections, biliary tract infections, also maybe due to cardiac catheterization, can be URTI or LRTI, can be due to skin infections, and so on. Now looking at underlying heart disease. So under heart diseases, what it can form is, it can be due to chronic valvular heart diseases or congenital heart diseases. So you might ask what? So it can include VSD, pulmonary stenosis, bicuspid aortic valve, or even coagulation of aorta can also be there. Now looking at impaired immune defense, impaired host defense. So under this, it can be impaired specific immunity in lymphomas, and also can be leukemias, and cytotoxic therapy by various cancers. For various cancers and transplant patients. We also have deficient functions of neutrophils and macrophages. Now quickly highlighting on the pathogenesis. Under pathogenesis, it can be due to previously damaged valves, and also be due to hemodynamic stress, as well as it can be due to non-bacterial thrombotic endocarditis. Okay, now quickly looking at some morphological features. There is typical presence of vegetation, of verrucae is present on the valve cups or leaflets. And then moving on, looking at other features, it mainly affects the left heart and mostly the mitral, and then the aortic, and then the mitral or aortic. This is in the order. Now moving on, similar to the RSD, what it does is the vegetations are located on the aortic surface of atrioventricular valve and ventricular surface of semilunar valves. And then moving ahead, it extends. So if you see the extension, it extends along the surface of the valves, can also extend to the adjacent endocardium. Now looking at the vegetations, they can vary from few millimeters to the few centimeters, and they can be a grey, tawny to greenish, and they are typically friable, can be single or multiple. And the vegetations of ABE are bulkier. So in terms of bulk, it's bulkier than SABE. And the microscopical features, there are three main features, that is the zones. First one being the outer layer, second one being basophilic area, and the third one being the deeper zone. So in case of the outer zone is also known as cap zone, and here what happens is there's eosinophilic material, and it contains of fibrin as well as platelets. Now moving ahead, in the basophilic, they contain the colonies of bacteria, And the bacterial component, in case of treated cases, it can be missing. Treated cases, it's missing. Whereas you can see the colonies of bacteria. Now in the deeper zone, there is non-specific inflammatory reaction. Inflammatory reaction in the cusps and can cause SAB. And in case of SAB, what happens is there can be repair that can be seen. So that's it. Thank you.